Hi, my name is Susan Rich, and I'm the Orthopedic Coordinator, Nurse Navigator for U of L Health Jewish Hospital, and I'd like to welcome you to your Total Joint class. Our goal today is to provide you and your caregivers with the information you'll need for a successful joint replacement by helping you gain a better understanding of what to expect before, during, and after the surgery. In the last 50 years, there have been such significant improvements in both material and techniques that total joint replacements have become one of the most successful surgical procedures in all of medicine. This class will help explain your joint replacement journey. Thank you, and welcome to Jewish Hospital's Total Joint class. Today we'll be discussing PATT, preparing your home, what you need to bring to the hospital, the day before your surgery, the day of your surgery, the actual surgery, your recovery room, our orthopedic unit on the 9th floor at Frazier, pain management, blood clot prevention, physical therapy, nursing care, discharge planning, equipment, and when to call the doctor. Pre-admission testing. When you and your surgeon have determined that your joint's ready to be replaced, the surgeon's scheduler will assign a surgery date and schedule your PATT, or your pre-admission testing and teaching. The mandatory PATT appointment will last about 2 to 3 hours and needs to be completed prior to your surgery. The mandatory PATT appointment will last 2 to 3 hours and needs to be completed prior to your surgery. Completing this appointment helps to prevent morning of surgery cancellation and alerts us of any potential problems that may exist. Your nurse will begin your PATT appointment by performing a basic medical assessment that includes height, weight, and vital signs. During the PATT appointment, you will have pre-surgery lab work and testing that includes blood work. Fasting's not required. You can eat prior to your testing. A urinalysis, a chest x-ray, an EKG, and a MRSA swab. If applicable, you may have a CT of your hip and your knee. The nurse will review your allergies, your medical and surgical history, and current medications that you're on. If possible, please bring your medications in their original containers. You'll be instructed which medications to continue and when you need to stop certain medications prior to your surgery. Write down your medical and surgical history, allergies, and the full name and phone number of all your current medical doctors so that you're not likely to forget, and this will save time during your appointment. You'll also have a skin check. Please inform your PATT nurse if you have any open cuts or wounds anywhere on your body. After your appointment is complete, don't shave with a blade razor and be very careful with pets. If you arrive the morning of surgery with any cuts, scrapes, bruises, blisters, rashes, hives, animal bites, or scratches, there is the potential for your surgery to be postponed to a later date or potentially canceled. You'll be given an antibacterial wash for your skin prep. Your nurse will review the instructions for the wash that's to be used the night before the surgery and the morning of your surgery. You'll also be given your total joint binder that contains the information we will be covering in the class. Preparing for surgery. You're about to undergo a total joint replacement, and now is the time to get your home ready for your return. Tell your family and friends about your surgery and gather your team together. Your team should consist of the people who will assist you at home day and night for the first 4 to 5 days after your surgery. Have your family and friends assist you to prepare your home and make any modifications before leaving for your surgery. Clear the stairs and pathways of clutter and tripping hazards like cords, furniture with sharp edges, or wide-based supports. Tape down loose carpet edges that stick up. Remove throw rugs. Have a well-lit home environment. Have a working smoke alarm. Place slip-proof mats or strips in the shower. Install handrails and/or grab bars on steps and in the bathroom. Furniture should be at a height for ease when sitting and standing. Place your chair, remote controls, radio, telephone, medicine, tissues, and wastebasket in the area where you will spend the most time while you recover. Arrange for help with shopping, housework, cooking, and errands. Move frequently used heavy items from high and low storage areas to the countertop. Stock up on basic foods and prepare freezable meals ahead of time that can be reheated and served easily. Make plans for someone to care for your pets, including feeding. The night before your surgery. The night before your surgery, you'll begin the cleansing process of the skin surrounding the surgical area. Using a washcloth, wash your entire body from head to toe with your regular soap and then rinse that off. If you're having a total knee replacement, after you rinse that soap and water off, use a different clean washcloth and take the antibacterial wash that you received in PATT and wash from the neck down to your toes on the same side of the knee that you're having replaced. Just avoid your eyes and your privates. Let that remain on the skin for a few minutes and then rinse that off. Towel dry with a clean towel. Put on fresh pajamas and sleep on freshly laundered linens. If you're having a total hip replacement, after you rinse the soap and water off, use a different clean washcloth and take the antibacterial wash, again that you received in pre-admission, and wash from the armpit to the knee on the side of the hip that you're having replaced. Just avoid your eyes and your privates. Let that remain on the skin for a few minutes, then rinse it off. Again, towel dry with a clean towel, put on fresh pajamas, and sleep on freshly laundered linens. The night before your surgery, we don't want you to eat any solid food after midnight. You may have clear liquids only up to 2 hours before your surgery. The following foods and drinks are allowed in a clear liquid diet. Again, only up to 2 hours prior to your surgery. Water, plain, carbonated or flavored, clear fruit juices without pulp, fruit-flavored beverages including fruit punch or lemonade, carbonated drinks including dark sodas, which would be colas or root beer, Jell-O, no fruit in the Jell-O, or plain popsicles, no cream in your popsicles, tea or coffee, without any milk, cream, or powdered creamer, sports drinks such as Gatorade, G or G2, Powerade, vitamin water, hard candy such as lemon drops or peppermints, and try to eat a sound meal and get a good night's sleep the night before your surgery. What you need to bring to the hospital: basic toiletries, toothbrush, toothpaste, brush, comb, deodorant. If you have hearing aids, make sure you bring their batteries. If you have eyeglasses, make sure you have a case. If you do bring a cell phone, again, make sure you pack your charger, a CPAP machine, and wear loose-fitting clothing. The day of surgery, pre-op. The morning of surgery, you want to complete your second shower using the antibacterial wash that you used the previous night. Don't wear makeup, nail polish, jewelry, or watches. Don't bring valuables, money, or jewelry. Wear clean, loose, comfortable clothing and a comfortable pair of walking shoes. Your family will wait in the waiting room while you're prepared for this surgery. At this time, visitation regulations vary due to the COVID-19 restrictions, and I'll talk more about this at the end of the presentation. The pre-op process may take up to 2 hours and includes current weight, checking vitals, and assistance undressing if needed. We will verify the information you provided during your pre-admission appointment to assure its accuracy. Your skin will be prepped for surgery. We'll start an IV for the first dose of antibiotics. You'll have 3 doses of antibiotics, 1 dose before surgery and 2 doses afterward. During this time, you'll also receive medications that help you decrease your pre-op anxiety and post-op nausea. You'll have a block prior to your surgery. This 2-injection procedure numbs the nerves surrounding the joint being replaced, so that when you wake up from surgery, you won't feel anything. We do these blocks for pain control. Our goal for you is to stay ahead of the pain. Don't let that pain get ahead of you. The blocks normally last anywhere from 16 to 24 hours, and we don't know how long the block will last in you. We just know it's usually somewhere within that time frame. After you are prepared for surgery, time permitting, your friends and family members will be allowed to come back to the pre-op area and wait with you until the time of surgery. Again, there are visitation restrictions at this time due to COVID-19, and I'll address them at the end. Total knee replacement. The knee joint is the largest joint in the body and has 3 different compartments. The medial compartment, which is on the inside of the knee, the lateral compartment, which is on the outside of the knee, and the patellofemoral compartment is where the kneecap glides up and down in the middle. The compartments are covered with a smooth white articular cartilage, and that allows for smooth movement of the joint. The loss of cartilage is referred to as arthritis. Once cartilage is damaged, the nerve endings in the bone are exposed and can lead to severe pain and stiffness. A total knee replacement is really a cartilage replacement. The knee itself is not replaced, but it's resurfaced. During the surgery, a thin amount of bone and the remaining diseased cartilage are removed from the end of the thigh bone, which is the femur. 2 holes are drilled in the end of the femur for the 2 posts of the prosthesis. The femoral component is then press fit and in some cases cemented in place. The surgeon then turns their attention to the bottom part of the leg. The top of the tibia is cut to remove the remaining cartilage and arthritis. A hole is drilled down the center for the metal stem, which is then placed in the center of the tibia. A plastic liner is placed on top of this component to separate the 2 metal pieces. The underside of the kneecap, your patella, is shaved to remove the arthritis, and 3 holes are drilled into the kneecap. Cement is placed on the back of the kneecap, and it is placed on your old kneecap to resurface it. Okay, let's take a look at the models, and we're going to start with anatomy. You have 2 bones below your knee, your fibula and your tibia. You have 1 bone above your knee, which is your femur. And then you have a big muscle here that comes down across that femur, across your knee, and attaches at the notch right down below your knee. The first incision your surgeon makes is going to be right down the center, and he'll cut until he gets to this muscle. Once he gets to that quadricep muscle, he doesn't cut into it. He comes at it from the side so that he can move that muscle off to the side and expose your knee joint. Now this is what your knee would look like if you're sitting with your feet flat on the floor. All this blue represents where you should have cartilage. Now the cartilage in your body is not blue. It's really similar to what's on the end of chicken bone, that really smooth, shiny, opaque material. You should have cartilage here on the top, down here on the bottom, and then even on the back of your kneecap, you should have smooth, shiny cartilage. Now you're here with me. Your knee is probably more on the line of this, where you've rubbed away your cartilage, both on the top, down here on the bottom, and even on the back of your kneecap, you've rubbed away your cartilage, and that's where your pain is coming from, where you have bone rubbing against bone. So what your surgeon's going to do is cut away the cartilage, cut away the arthritis, and they'll cap the end of your bones with this hardware. Now this is 3 of the 4 pieces that'll go into your knee replacement. The top piece is made of metal. It's made of a titanium chrome cobalt combination, and on the inside there are 2 posts. That piece will sit on a shelf of plastic. This plastic is made of a high-density polyethylene. This plastic liner takes the place of the cartilage that you no longer have. And then that sits on another shelf of metal, again made of the titanium chrome cobalt combination. So this is actually the real hardware that would go in your total knee. So this is a plastic model. This model shows what your knee is going to look like with the hardware attached from your front view and then your side view. You can see on the side view the angles they have to shave so that it'll fit inside your new hardware. So they shave the ends off, drill 2 holes for the post, and then this piece will press fit in place. So that's the top part of your knee replacement. The bottom part, again, they're going to shave this down, drill a hole down the center for the stem, and then these 2 pieces will also snap in place. So that's 3 of the 4 parts to your knee replacement. Now we'll turn the attention to the kneecap. Your kneecap is actually embedded on the underside of that quadricep muscle. It stays there during surgery. They don't take it out. What the surgeons will do is shave this down nice and smooth, get rid of the cartilage and arthritis, drill 3 holes for the post on the back of your kneecap, and then your new kneecap will actually be cemented onto your old kneecap. It'll resurface your own kneecap. That way, when they drop the quadricep back where it should be, your new kneecap will be able to glide up and down in this track as you bend and straighten your knee. What to expect during surgery. Surgery may last anywhere from 1.5 to 2 hours. You'll have 2 to 3 layers of sutures on the inside. The outside incision will be closed in one of 2 ways. The first way is 1 layer of staples. If you have staples on the outside, they'll remain in place for 10 to 16 days and then they'll be removed. If your incision is covered with the liquid adhesive glue mesh, it will be removed on your follow-up appointment with your orthopedic surgeon. At this time, your surgeon will update your family about your knee replacement procedure. Although not a normal knee, a replaced knee provides relief from the arthritis pain. Most patients have a decrease in their pain with improvement in knee function, and that allows them to remain active and enjoy activities that have been limited because of the pain. Okay, now we're going to talk about the total hip replacement. There are 2 parts of your body that make up the hip joint. The pelvis, which contains the socket part of your hip, and the femur, which contains the ball part of your hip joint. After the initial incision is made, the hip will be dislocated into 2 pieces, the femur and the pelvis. The damaged femoral head is removed, and the center of the femur is drilled and replaced with a metal stem that's placed into the hollow center of the femur. The femoral stem may either be cemented or press fit into the bone. A metal ball is placed on the upper part of the stem, and this ball replaces the damaged femoral head that was removed. The damaged cartilage surface of the socket, which is your acetabulum, is reamed or sanded down and replaced with a metal socket. Screws or cement are sometimes used to hold the socket in place. The metal components are made of titanium, chrome, and cobalt, and a plastic liner made of a high-density polyethylene is placed inside the metal cup and separates the 2 metal pieces. This allows for the smooth surface of the plastic cup to rub against the smooth metal femoral head for comfortable motion. Okay, now we're going to go to the model. Okay, so this is a model of the left hip. After that initial incision is made, again, your surgeon is going to dislocate your hip into 2 pieces. And we'll start with the femur. The first thing they're going to do is saw that head off, drill a hole down the center for the stem, and then these 2 pieces will press fit in place. Again, the stem and the ball are made of a titanium chrome cobalt. After that, they'll turn their attention to the pelvis. What they're going to do on the pelvis is sand it down nice and smooth. They call it reaming, but they'll sand it down nice and smooth to accept your cup. Your cup's going to be in 2 pieces. The outside is made of metal. It's a titanium chrome cobalt. On the inside is a plastic liner. This plastic liner, again, takes the place of the cartilage that you no longer have. and then once this is sanded down nice and smooth, it's going to pop in place. Now, I have a model, so these are magnets. You will not have these magnets in your hip. Going to pop in place. Then they'll relocate your hip. What to expect? Your surgery may last anywhere from 1.5 to 2 hours. You'll have 2 to 3 layers of sutures on the inside. On the outside, that incision will be closed again in one of 2 ways. The first way is staples. If you have staples on the outside, they'll remain in for 10 to 16 days and then they'll be removed. Or the outside will be closed with a liquid adhesive glue mesh. If your incision is covered with the glue mesh, it will be removed on your follow-up appointment with your orthopedic surgeon. After your surgery is over, your surgeon will update your family about the hip replacement procedure. This surgery provides pain relief and restoration of joint function. PACU, or the recovery room. After surgery, you'll be transferred from the OR to the recovery room. You'll stay in the recovery room for about 2 hours. The majority of time you'll sleep. You'll be on a continuous heart monitor, receive IV fluids, and your pain will be monitored. If space is available, your family may be allowed to visit you. If not, your nurse will periodically update your family and friends of your progress. And again, I'll talk with you about the visitation restrictions at the end of this. After about 2 hours in the recovery room, you'll be moved to our orthopedic floor on the 9th floor of Fraser Rehab Institute. So you'll be a Jewish hospital patient, but you'll be in our unit located on the 9th floor of Fraser Rehab. 9 Fraser Nursing Care. When you arrive on our orthopedic unit, your nurse will review your home medications, your allergies, and the past medical history. Your nurse will also perform a physical assessment, monitor your vitals, and administer the medications that your doctor has prescribed. Your surgeon will order antibiotics, pain medications, and blood thinners to be given after surgery. A medical doctor will be consulted to assist in coordinating your care while you're in the hospital. The nurses will also check to make sure that you have on your TED hose and your foot pumps. TED hose are the knee-high white compression stockings. You'll have these on both of your legs. You'll also have foot pumps and sequential compression devices, or SCDs. The foot pumps and the SCDs wrap around your foot or calf and are used to compress the veins in your leg. The compression devices will be on both lower extremities while you're in the hospital and will be attached with tubing to a control box at the end of your bed. The pumps will inflate and compress your foot or calf, and then they will deflate. The TED hose and the foot pumps assist in minimizing potential swelling and help to decrease your chance of developing blood clots. After discharge, you will continue to wear the TED hose on both of your legs until your follow-up appointment with your surgeon, which will be in approximately 2 weeks after your surgery. You should wear them during the day when you're up and moving around. At nighttime, you don't have to wear them. You can take them off, wash them, hang them up to dry, but before you get up and start moving around the next morning, you need to put the dry TED hose back on. While you're in the hospital, we want to keep you as safe as possible. Please use your call button to call for assistance every time you need to get out of the bed. As a hospital patient in a very unfamiliar setting, you may be surprised how difficult and even dangerous simple things can be, such as getting out of the bed to the chair, getting up to the bathroom, reaching for objects while lying down and getting dressed. Trying to do these things on your own could lead to a fall, which may cause a serious injury. We understand that your family is willing to help, but while you're a patient, we would like you to call for our assistance. The staff will put your skid-proof socks on and attach the gait belt around your waist prior to getting you up. Both the skid-proof socks and the gait belt must be used every time that you get out of bed to walk. It is for your safety. Pain management. On admission to our orthopedic unit, your nurse will be discussing the type of pain medications your surgeon has ordered. Our nurses are here to assist you in keeping your postoperative pain at a tolerable level by performing pain assessments. Pain assessments are performed by your nurse to assist you in keeping ahead of the pain. The key to getting through this is to get ahead of the pain and stay ahead of the pain. Don't let the pain get ahead of you. Our surgeons use a multimodal approach to pain management that uses 2 or more different medications to manage pain rather than using opioids alone. This approach is assisting with decreasing the opioid use. Pain management is one of the most important factors in your recovery, and that's why we utilize the blocks we discussed earlier. But we all know from the minute you get your block, it's already starting to wear off. But remember, that block lasts about 16 to 24 hours. When your block gets to a point where you can start feeling a tingling type sensation, or you notice a change in the way that your leg has been feeling since surgery, that's your indication, and you're the only one that's going to know that the block is almost out of your system. And that's when you need to react and ask for your nurse to bring your pain pills. An example of a change could be you reach down and touch your thigh after surgery and you don't feel a thing. But later, in the middle of the night, you reach down and touch your thigh and you feel something. It may not be a normal feeling, but it's different than how your leg has been feeling since surgery. And that's a change. That's when you need to react and use your call button to ask your nurse to bring your pain pills. Again, these pain blocks work great, but it's always dropping and becoming less effective. And then that block gets to a point and it starts letting you know, either by the change or a tingle, that it's almost out of your system. And that's when you need to react and ask for your pain pills. If you ignore the warning signs because you're not hurting, the block continues to drop. And it'll be there, and then it'll quickly be eliminated from your system. And if you haven't taken any pain pills, you don't have anything to block that surgical pain. And at that point, it's almost like an overwhelming tidal wave of pain that'll hit you, and you don't want to get to that point. That's why it is very important, as soon as you notice a tingle or a change, you need to use the call button and request your pain pills. Your pain medication will be ordered by your surgeon and is available every 4 to 6 hours. But you must ask for the pain medication. It will not automatically be brought to you by your nurse. To manage your pain after your block wears off, you'll normally have access to both pain pills and IV pain medication. Your pain pills need to be your primary mode of pain relief as the block begins to wear off, because the pain pills that you use here in the hospital are the same or comparable to the pain pills you'll be prescribed for home. And we need to make sure that the medication you're taking here in the hospital works for you. Now, I don't want to discourage you from using the IV pain medication. It does have its purpose. The purpose of the IV pain medication is to help you transition from the block to the pain pills. IV medication can be used initially when the pain pills aren't lasting long enough or the pain is more than you can tolerate. But once the pain is tolerable and under control, you need to stop using that IV pain medication and try to use only the pain pills. Because again, the pain pills will be prescribed for home use and the IV pain medication will not be going home with you. You notice I referred to your pain as tolerable. The only time you'll be pain-free during your recovery is when that block is working. Once the block wears off, all the medications you receive will take the edge off, but you will not be pain-free. The pain you experience after your block wears off is acute pain from the surgical procedure. It is totally different than the arthritis pain that you experienced prior to surgery. The pre-op arthritis pain will be gone. The pain you have after surgery is from your incision, and as you are up moving around and exercising, you'll gradually get rid of this pain. Most joint replacement patients experience their highest pain peak 2 to 4 days after your surgery. Now we've got a list of some pain medication tips. Never take pain medication on an empty stomach, as it can cause nausea. Take your pain medications with a light snack. Pain medications can cause severe constipation, so drink plenty of water along with a high-fiber diet. Taking over-the-counter stool softeners and laxatives can also help. Take your pain medication 30 to 45 minutes prior to any physical therapy sessions to allow for the medication to be effective during your activity. Physical therapy. After surgery, if we can get you checked into the 9th floor of Fraser by 5 o'clock p.m., we do have physical therapists that are eagerly waiting your arrival to get you up and attempt a few steps or even a short walk using the rolling walker and a gait belt. Now remember, you've had a block that'll still be working, so the therapy staff will attempt to walk you. However, to be safe, it may be necessary to only take a few steps over to the bedside chair. Your walking distance will be determined by your therapist once they stand you on your feet and are able to observe the effect of the block on your muscles. After your first physical therapy session, we want you to sit up in the bedside chair for a couple of hours to start clearing the anesthetic out of your system. After sitting for 2 hours, use the call button to let your nursing staff know and they will assist you back to bed. If you've had a total knee replacement, the next morning, post-op day number 1, you will continue your physical therapy. Your therapy sessions will consist of exercises, mobility skills, such as getting in and out of bed and up and down out of the chair or the toilet, walking short distances so that you can get everywhere around your house. Your knee has 2 primary movements that we're concerned with: flexion, which is the bending part, and extension, which is the straightening part. Positioning your knee while resting without a pillow under the knee will promote extension, and performing range of motion exercises will promote flexion. Both are equally important. Getting range of motion in the early phases of your rehab is essential. The physical therapist or physical therapist assistant will review your total knee exercises. The exercises may feel uncomfortable at first, but they'll help speed your recovery and diminish your post-operative pain. The total knee exercises are designed to help strengthen your muscles, improve knee movement, and increase circulation to your legs and feet, which are important for preventing blood clots. Once at home, you'll perform these same exercises 2 to 3 times a day, in addition to the home health or outpatient physical therapy services you'll receive. Discharge home with home health or outpatient physical therapy is planned for post-op day number 1, which is the day after your surgery. These exercises are located in the white total knee replacement binder that you received or will receive at your PATT appointment. Starting the day that you receive that binder, review the exercises twice a day, every day until the day of your surgery. Go through the motions and make sure you know all the exercises so you'll be familiar with them and prepared to begin your therapy in the hospital. If you've had a total hip replacement, the next morning, post-op day number 1, you'll continue your physical therapy. Your therapy sessions will consist of mobility skills, such as getting in and out of the bed, up and down from a chair or a toilet, and walking short distances so you can get around your house. If you have precautions with your total hip, the physical therapist will review them so that you can begin incorporating them into your daily activities. Again, discharge home with home health or outpatient physical therapy is planned for post-op day 1, which is the day after surgery. Discharge planning. Now is the time to begin planning for your discharge and making arrangements with family and friends to provide you with supportive care for the first 4 to 5 days after surgery. We don't recommend anyone go home alone. This support team will be there at home to help you establish an exercise and pain management routine, as well as assist with showering and meal preparation. After your arrival to the orthopedic unit, our discharge planner will speak with you and begin arranging and assisting you with your discharge needs, which would be equipment and your continued therapy. Your discharge planner will provide you with the choice of available home health providers, or if your surgeon prefers, outpatient PT. The home health or outpatient physical therapy will continue at least 2 weeks until your follow-up visit, and at that time, your surgeon will make further therapy recommendations. Your discharge from Jewish Hospital will be determined by your mobility skills. Can you get out of the bed by yourself or with little to no help? How well you can safely walk and maintain precautions, if any. Pain control. Are you stable medically? This will be determined by the medical doctor that is overseeing your care while you're in the hospital. The availability of persons to assist you for 4 to 5 days after your discharge from Jewish, and your equipment that will be ordered by your care manager and delivered to your room prior to discharge. Our goal for you is that you're able to return to your own home at discharge. However, in some circumstances, that's not possible and a rehab facility may be needed. Most insurance companies do not cover inpatient acute rehab stays for elective procedures without just cause. If you do meet the criteria for a stay at a subacute rehab facility, you will be transferred to the rehab facility by either a family member or friend or a transport service to receive additional physical therapy and occupational therapy until your goals of discharge have been achieved. Incision care. You will be given specific instructions at the time of discharge regarding the care of your incision and when you may take a shower. Notify your surgeon's office of any signs of infection, increased drainage, redness, increased pain, odor, or warmth around the incision. After your joint replacement, it's very important that you notify all your doctors that you have an artificial joint, because anytime they want to do any type of invasive procedure on you, which would be a surgical procedure, a colonoscopy, a bronchoscopy, a dental procedure, and this does include cleaning, you are required to have prescribed antibiotics prior to this procedure, and that is going to be for the rest of your life. When to call the doctor. If you have chest pain or shortness of breath, call 911. If you have a fever consistently over 100.5 degrees or shaking and chills, if you have excessive redness or pain around your incision, if you have continued drainage from the incision or the incision begins to drain, if you have excessive swelling in the operative leg or pain and redness in either calf below the knee, sudden pain, shortening, and rotation of the operative leg, and that's for total hip replacements only. Visiting hours due to COVID. Visiting hours are currently from 10 a.m. to 7 p.m. and only one person is allowed per patient. No visitors are allowed in the pre-op or the recovery room, and no overnight visitors are allowed at this time. This policy is subject to change at any time. A mandatory COVID test is required prior to your surgery. This preoperative screening will be scheduled by your surgeon's office approximately 4 days prior to the date of your surgery. After the COVID test is completed, you will need to self-quarantine. Failure to get the COVID test or self-quarantine prior to your surgery will result. Failure to get the COVID test and self-quarantine prior to your surgery will result in the cancellation of your case. Thank you for choosing U of L Health Jewish Hospital for your orthopedic surgery. If at any time you have questions or need additional support, please do not hesitate to contact me at the numbers below. Also, my contact information is located on the front of the white total joint binder you received in pre-admission.